802-5443 y hay un código de marcar 719-0500 y ahí está en la chat. Thank you.
Okay. Welcome everyone. Again, my name is David West. I'm with the Labor Center on the South Seattle campus. And Labor Center is a state-supported organization. Welcome to our Workers' Rights in COVID-19 coronavirus era, a series sponsored by the Labor Education Research Center with support from the Federation of State Employees, the State Labor Council, and SEIU Local 925. Labor Center is part of South Seattle College. It is the practice of the Seattle colleges to begin each meeting with a land acknowledgement, honoring the peoples upon whose land our classrooms stand. Although tonight we're scattered across the internet, I invite you to join me in this acknowledgement. We acknowledge the people, past, present, and future, of the Duwamish tribe, the Muckleshoot tribe, Sammamish tribe, and other people of the Salish Sea on whose traditional lands we study and work. Thank you. Labor Center is a nonpartisan program of the State Board of Community and Technical Colleges, housed at South Seattle College. Our mission is to provide education and tools for empowerment to workers across the state. We have traditionally focused on the legal rights of workers and on labor history. This webinar grows out of our Know Your Rights at Work training series. As the public health and economic crisis has hit our communities, working people have urgent new questions about their rights. We have gathered for you experts who will try to answer them tonight. Opinions and information expressed belong to the speakers, not to the Labor Center. But we hope if you find anything valuable, you will share it with your coworkers, family, and neighbors. The meeting is open to the public. It will be recorded, and the link to the recording, including the chat contents, will be sent out to everyone who registered in the next several days. Tonight is the fourth in our series, and we'll cover health insurance. Our guests today are Joan Altman, Associate Director of Legislative and External Affairs for the Washington Health Benefit Exchange, Jane Beyer, Senior Health Policy Advisor in the Office of the Insurance Commissioner, and Sam Hatzenbeler, Health Policy Associate at the Economic Opportunity Institute. A couple of quick reminders. If you want to ask a question, use the Q&A button. Adair is monitoring the questions and we'll try to get to as many of them as we can. If you have a comment to share with the audience, want to suggest a resource or link, click on chat and watch the chat box during the webinar. Ideas and web links will pop up there. Interpretation, again, interpretation tonight is available in Spanish. Siobhan will give the number once again for translation.
Si busca interpretación en español, favor de llamar a la línea 701-802-5443. Hay que marcar un código que es 719-0500. También esta información está en la chat. Thank you.
Thank you. We'll start our presentations today with Joan Altman. And we've asked her to start with how Washington workers can access health insurance if they've got reduced hours, a furlough, or a layoff situation. Joan, you want to start?
I'd be happy to. Thanks so much, David. Great. Can you all see my screen okay?
Yep.
Wonderful. Well, good evening, and thanks to everyone for joining, and thank you so much for having me. I'm Joan Altman. I work at the Washington Health Benefit Exchange. The Washington Health Benefit Exchange runs Washington Health Plan Finder, where 1 in 4 residents in the state of Washington come to get their health care. We know these are very trying times. We know they're very unsettling times, and we're doing everything we can to connect you, your loved ones, your coworkers, your neighbors, your friends, your family with health coverage, working closely with our partners at the Insurance Commissioner's Office, the Healthcare Authority, Department of Health, Employment Security, really coordinating efforts to try to make sure everyone knows how to get health coverage during this pandemic and knows the opportunities available to them in Washington that aren't necessarily available in the rest of the country. So I'm going to speak for 10 minutes or so. I'm going to touch on Washington Health Plan Finder background, but really focused mostly on where people who are currently uninsured today can go to sign up for care, how long they have to do it, and also throughout the coverage year, if they experience a loss of employment coverage or a loss of income or a job loss or they're furloughed, how you can connect people to coverage through Washington Health Plan Finder. I wanted to start off with just a few key messages. The first being that if you are currently uninsured or you will be losing your healthcare coverage soon, there are free and low cost options available to you here in the state of Washington through Health Plan Finder. I also wanted to make sure to share our official website. We've seen some copycat websites pop up, and if you've never used Washington Health Plan Finder, or if it's not bookmarked for you, wanted to make sure that you were aware of lookalike sites and ads. And here you'll see an example. I just Googled myself before this meeting, Googled Washington Health Plan Finder. And this is an example of what you'll see. You know, there's some advertisements up top that are largely broker-driven groups. Down here, WashingtonHealthPlanFinder.org, the homepage, this is us. And this will, of course, differ based on who's targeting you for ads. This is what our homepage looks like. This is our official homepage. It has our logo in the upper left. And again, there's our URL. A few things to point out. Once you get to Health Plan Finder, there is a website that's in Spanish that's available to you. There's also a customer support button that can connect you to a lot of the resources that I'll mention tonight. Second key message, just to highlight, we have a network of over 2,000 trained navigators and brokers across the state who are ready to answer your questions, come to your place of employment, share information, provide one-on-one assistance to you if you have questions about your health insurance, if you need a little bit of additional explanation about how to use our system, or if you need help picking a plan for you. We also have a customer support center that's located in Spokane. It is open from 7:30 to 5:30. Most people now are working remotely, all of them, but again, still available to you, still providing language assistance and disability accommodations at no cost. Final key takeaway message, subsidies are available through Health Plan Finder to help you lower the cost of your premiums and your cost sharing. And these subsidies are more generous than most people realize. So I did want to point out that federal premium tax credits go up to 400% of the federal poverty level, which for someone who is single means making up to $50,000 a year. And for up to a family of 4, it means making over $100,000 a year. So you'll see here with the guidelines that I've laid out, you know, between all the way up from essentially the 138 to the 400, you have assistance, and under 138, it's free care for you through Apple Health. There are also some Apple Health programs that help you in the middle income ranges. So quickly, the Affordable Care Act in Washington State opted for full implementation of the Affordable Care Act. That means we expanded Medicaid. So there are expanded Medicaid options available to residents. It also means that they established a state-based marketplace, which is the Washington Health Benefit Exchange. We have an 11-member board. We run the website. It's an integrated portal. So in the state, you come through one door and we assess your eligibility, and you either go into Apple Health or you go into a commercial insurance product. Same door for all populations, connecting you to quality health coverage. The two main programs we'll talk about today, Washington Apple Health. Again, Washington Apple Health is an umbrella term. It means there are a bunch of different Medicaid programs that sit underneath that Apple Health umbrella, but it offers comprehensive medical coverage. There's no premium. There's generally no or limited cost sharing. It's year round. You can come in at any time during the year and sign up through Health Plan Finder. You can have some members of your household, and we have many, where kids are on CHIP or on a different Apple Health program and the adults are on a commercial product. And you can also have Apple Health while you have other coverage. So if you have employer coverage, that would wrap around your Apple Health coverage. The commercial health products, also known as qualified health plans, they're offered across the state. We have 9 carriers who offer different levels of coverage. It's like the Olympics, gold, silver, bronze, catastrophic are the different levels you can get. They all have to have the same robust health benefits. And again, as I mentioned, we have about $600 million in federal subsidies that we distribute Washingtonians over the year through our system. And we highly encourage people who are looking for an affordable option to come see what kind of federal assistance they could be available to them. Typically, we have one open enrollment period throughout the year. We've extended that because of COVID, and we also want to highlight some other special enrollment opportunities. So again, here's our website. I want to note for you, browse plans. If you don't want to go through the whole process of enrolling, if you're someone who just is choosing between various options and you want to compare your COBRA option to your Washington Health Plan Finder option, you can come hit browse plans from our website and enter just a little bit of information about yourself and see what plans are available to you and what they cost to help you make your decisions. We also have tools available to help you select a plan. So as I mentioned at the outset, if you're uninsured, we have a special enrollment period that is a new time-limited opportunity we put in place in response to the pandemic. You have until May 8th to sign up for coverage. No questions asked, no qualifying event needed. You call our call center, you talk to a broker, you talk to a navigator, they'll get you through, you sign up, and you get coverage as of May 1st. You can, again, over 17,000, since we opened the special enrollment at the beginning of March, we've had over 17,000 people come through and sign up. So this is an option that a lot of people are taking advantage of, and we want to make sure everyone's aware of it. We're running an outreach campaign now, but we really appreciate everyone's help spreading the word, talking to everyone you know, letting them know this opportunity exists here. Also, there are sort of ongoing opportunities for people to sign up. So if something happens to you in your life, if you lose or will soon lose your employer coverage, you can come in and sign up. If you lost your job, you can sign up. If you lost income, you can sign up. If you've been furloughed, you can sign up. If you have coverage off exchange through a health sharing ministry, for example, that has received a cease and desist order, you can come into the exchange and sign up. If you signed up off exchange and have had a change in circumstance where you now could qualify for one of these subsidies that I'm mentioning to you, you can come in off the exchange and come into on exchange coverage and get those subsidies and get more affordable health care. There's also just sort of typical, if you've had a change in your household composition, if someone's come to move in with you, if you've gotten married, if you've gotten divorced, there are all these reasons that could cause you to have an opportunity to come in and enroll. And there's a list of qualifying events there listed on the slide. Again, to reiterate with Washington Apple Health, this is the program that's run by the Healthcare Authority. You will not lose your Apple Health coverage during the pandemic. So if you come in and get Washington Apple Health, you will stay on Washington Apple Health for the duration of the pandemic, even if your income fluctuates or your circumstances change, unless you request that it end. We have lots of materials we've been creating and putting online. I know the links and some of the documents will be available to you. I will just add here that if there is a document that would be helpful to you, your coworkers, your employer, in addition to letting us know if it would be of interest to have someone come speak to your group specifically, we're happy to develop specific materials and or create things that if they would be of use to you. So definitely let me know. My contact information is in this presentation if it would benefit you or the people you work with or work for to have us come provide more information or to develop a specific insert for your group. Looking at some specifics, first let's talk about loss of employer-sponsored coverage. You have up to 60 days before or after you lose your job to come into Health Plan Finder and get coverage. So if it's something where you've been told in a few months, 50 days from now, 55 days from now, you're going to get laid off and you're wondering what to do and how to compare options, you can come into Health Plan Finder, put your end date into our system and look at your options. This can be done entirely online. Also, there's the in-person or the one-on-one assistance available to you. COBRA, this is a common area where we get questions. Washington Health Plan Finder, there's typically a low cost or lower cost option available in comparing COBRA coverage and Health Plan Finder coverage. If you are someone who has already lost your job and you signed up for COBRA, if you are within 60 days of your end date, you can still come in and shop on the exchange and come on into the exchange if that's a better option for you. During your COBRA coverage, there also may be experiences that will allow you to come in and get covered. And finally, at the end of your COBRA coverage, you also have an opportunity to come in again within 60 days of your COBRA end date. So we highly encourage people if they are facing unemployment and wanting to compare COBRA to other options that are available to them, to come in and explore on Health Plan Finder. We also have several people now who've contacted us about furlough and unpaid leave. Reduction in your work hours could absolutely make you eligible for free or low-cost care through Washington Apple Health. Even if you have employer coverage, as I mentioned earlier, you can still be on Washington Health while you have your employer coverage. And there are people at Healthcare Authority who can help you coordinate those benefits and have your premiums and cost sharing covered. I'll note that we also have people who are on unpaid leave or they're still employed, but their income has gone to zero. When you are coming into Health Plan Finder to explore your options, we need you to put in that you're making at least 1 cent to move through our system. It's a glitch we're working on, but wanted to raise it for people to be aware of. Job loss can also make you eligible for low and free cost care. If you have a change in income that qualifies you for a subsidy, you can come on in and we want you to come in and report it and we'll assess that for you. For Washington Apple Health, it's important to know that that is a very immediate way for you to come in and get coverage. And Washington Apple Health can also help you pay unpaid medical bills from up to 3 months ago. So if you've accrued some costs during the time that you've been uninsured and you come in and you qualify for Washington Apple Health, you could get some immediate assistance. Finally, another common scenario we're being asked about right now is reporting your unemployment income. There's several new types of unemployment income and federal stimulus money that's been federally granted. Some of those you do not need to enter when you're reporting on your income in Health Plan Finder. We have on the FAQ page that you'll have access to that's included in this slide presentation. It points you to our FAQ, coronavirus FAQ page where some of this information is located. You don't need to report your stimulus money that you're getting from the federal government, and you don't need to report the $600 bump that you may have received also. And we have people who can help share that information with you as well. That is it for my presentation. I'll note that really, I highly encourage people, if you want to follow our most recent information, you can follow us all on social media and help us amplify our message to let people know where their coverage options are. You're also more than welcome to contact me with questions, requests for have navigators come to talk to you or the people you work with, or with specific material requests that we can help you with. And with that, I will stop sharing and turn it back over.
Great, thanks, Joan. That's very helpful. And so we have some of that information. I think we caught a lot of it in our chat box. Obviously you can go to the Exchange's website and as well as talk to the navigators. Let's move to Jane Beyer from the Office of the Insurance Commissioner, and she's going to talk about insurance rights and protection now related to COVID. Jane?
Thank you so much, David, and thanks so much for inviting me to present. And I think what I can say is Joan did a great job talking about getting access to coverage, and where the Insurance Commissioner's Office has been focused over the past several weeks and now coming to be months is on what is covered during the COVID emergency. So next slide, please. First, I want to just take a minute to explain the scope of the authority of the Insurance Commissioner. Insurance Commissioner Kreidler regulates what we call fully insured health coverage. And so it's health insurance that's sold by entities like Kaiser Permanente and Blue Cross Blue Shield plans like Premera and Regents, and also insurers like Aetna and United Healthcare. And we regulate a number of different types of health insurance, but importantly, we cannot regulate, we as the state cannot regulate self-funded group health plans. And over half of employer-sponsored health plans are actually self-funded. And that means that the employer is saying, I'm going to take on the financial risk of providing health coverage to my employees rather than having an insurance company do it. And I'll talk to you a little bit at the end about the one instance where we are able to impact what self-funded group health plans do. Next slide, please. Okay, we can skip this one too, I think, in the interest of time. So during the COVID emergency, the commissioner is fortunate that in 2009, the state legislature gave him authority to issue emergency orders. And one of the pieces of that authority is to issue orders for medical coverage to ensure access to care. And that's really been the core that the commissioner has acted on during the COVID emergency. The initial duration of an order is 60 days with the ability to extend an order for 30 days. And if, God forbid, this goes on longer than that, the commissioner can reissue orders to keep protections in place. Next slide. And throughout this emergency, we have been closely coordinating with the governor's office, with the Department of Health, with the Health Benefit Exchange, with the Healthcare Authority, with the legislature, all around trying to have consistent policies and consistent information for consumers, whether they're a Medicaid client, whether they're getting their benefits through the exchange, whether it's employer-sponsored coverage, or whether it's a state employee or school employee that's covered through the state. Next slide. So let's talk a bit about, again, that theme of what gets covered during the COVID emergency. First of all, the insurance commissioner recognized, and we got lots of input from healthcare providers and from consumers about how some people were being told not to come into the doctor's office or an emergency room. Some people just don't feel comfortable doing that given the COVID emergency. And so essentially what the commissioner did was say to insurance companies, you need to expand the ways that you can actually provide and cover telehealth services, even so far as including just a plain old telephone call. And then at the same time, our State Department of Health issued rules to relax requirements so that telehealth could be happening. And even the federal government sort of relaxed their enforcement of federal privacy, health information privacy, so that platforms like Zoom and FaceTime and Skype, Zoom as long as it's secure, could be used for telemedicine visits. Next slide. And the next issue that came up, this one mainly from healthcare providers, was wanting to know that if they wanted to use telehealth and see their patients that way, they needed to be paid the same amount that they would be paid if they saw their patients in person. Because we have heard a lot from providers about 60% or 50% of appointments being canceled, especially primary care providers and pediatricians and mental health providers and substance use disorder counselors. And we wanted to make sure that they were going to be compensated adequately when they were using telehealth services. And this was an issue where the commissioner didn't have the authority to do this. So we asked the governor to do it under his emergency authority, and within 36 hours of our request, an emergency order was out. And the Medicaid program actually had already, even before we did, implemented this payment parity. Next slide. Okay, so here's other things that we heard from consumers about. Consumers were worried about having an adequate supply of their medication. So we issued an order that basically required insurance companies to do a one-time refill for consumers so that they could have an adequate supply of their medications. And the Medicaid program did the same thing through an emergency rule. The one issue that did come up was, some of you might remember when there was an announcement from the White House that chloroquine might be a promising drug. And we immediately after that, prescriptions for that drug just jumped by like tens of times of what they normally were. But yet people with lupus and rheumatoid arthritis have been taking those drugs for years and rely on them. So we gave the health insurers the ability to set prescribing limits, quantity prescribing limits, if there were concerns about having enough of a drug so that people who depended upon that drug would be able to get access to it. Next slide. In addition, the commissioner ordered that there could be no cost sharing and no application of a deductible for COVID-19 testing. And if a doctor decided, for example, that before doing a COVID-19 test, or because there weren't enough COVID-19 tests, they wanted a test for flu or some other kind of virus, that would be covered without cost sharing, and also the visit to the doctor. And actually, Congress followed along after that and enacted very similar protections. We also said to the insurance companies, no prior authorization requirements can be imposed for COVID testing or treatment, because we wanted to make absolutely sure that people were going to be able to access their care. And then we also reminded insurance companies about the rules that we already have in place to make sure that they have enough providers to meet the needs of their enrollees. And then finally, we issued an order so that when somebody was ready to leave the hospital because of all the concerns about people that would be coming into the hospital with COVID, we issued an order that said to the insurance companies, if somebody's ready to go home or ready to go to long-term care services, you either have no prior authorization requirements or you speed those things up so we can make sure folks can safely transition. Next slide, please. We do know, as I indicated, that there really, it's been a big hit on a lot of providers. Again, especially we have a concern about mental health and substance use disorder providers. The legislature at the very end of its session appropriated $200 million for a variety of purposes. Some of that was to help with COVID-19 hospital costs. And then many of you have heard about the CARES Act that was passed by Congress. There's $175 billion that's going out to providers, although I will note there are a lot of providers in the United States, and $170 billion sounds like an incredible amount of money, but there are also an incredible number of providers. And then we have a number of insurance companies that have said, we're going to try to process these claims more quickly so we can get the payments out to providers. And Premera, which is our big Blue Cross plan, actually set aside $100 million to make advance payments to providers to try to get funding to them during this really challenging time. Next slide. Can we get the next slide, please? Thank you. Okay, and great, we're good. So I did want to just take a couple of minutes to talk to you about a new law that went into effect on January 1. It's called the Balanced Billing Protection Act. And this is not just limited to COVID. This is everything. And again, this is along the lines of protecting consumers from getting bills from doctors and other providers who are not in your health plan's network. So if you go to an emergency room and it's an out-of-network hospital because that's where the ambulance took you, or it's an in-network hospital and the emergency room doctor that takes care of you isn't in your health plan's network, or if you do the right thing and you go to a hospital that's in your network to get, for example, a surgery that's an elective surgery, but the pathologist or the anesthesiologist or the radiologist that is involved in your care is not in your health plan's network, they cannot bill you any more than what your obligation is for just your regular old cost share. Next slide. And the critical thing is when the surprise billing prohibition applies, for you, for the consumer, it's just like you've gone to a healthcare provider that's in your health plan's network. You're paying your in-network cost sharing, and you don't get billed for anything other than that. And really importantly, it is illegal for a healthcare provider to try to get you to agree to give up your right to not be balance billed. Next slide. And there are a number of ways that you will be informed of your rights if, taking our example, you're getting an appointment to have surgery done at a hospital that's in your network, when that doctor or surgeon or hospital schedules your appointment, they need to give you a notice that gives you your rights. That notice has been translated into 11 languages. And then also, when starting July 1, because of complications and delays on the insurance company side, when you get your explanation of benefits that says, here's what we paid for your plan, it'll have a message that says whether that claim and that service is protected under the Balanced Billing Protection Act. Next slide. And what does this law apply to? Remember, back at the very beginning, I talked about the plans that the insurance commissioner can regulate. So it applies to all the plans that we regulate: the Washington State Employees Plan, the new state school employees health plan, and it does give self-funded group health plans that want to provide these protections to their employees the opportunity to come in and give those protections. And just really quickly, next slide, we can let you know that as of April this month, over 200 self-funded plans have opted in. A lot of local governmental entities have come in. The Association of Washington Cities plans, the King County, Snohomish County, you can see the list on here. So it's great to know that all those local governments have stepped up to give their employees these protections. We are also hoping that some self-funded Taft-Hartley plans, which are the health plans that are negotiated by unions, will come in. At this point, the Teamsters is a member. And we're happy to talk more about this to you or any group that you work with. Next slide. And we have the link to our website where you can see a list of the self-funded group health plans that have come in. We also have a wealth of information on our website for consumers and others about using and making sure that their balanced billing rights are protected. And so that's it. Please feel free to reach out to me with any questions. I've got our websites up here, and I think that the Labor Center is going to be also providing you with our 1-800 phone line for consumers to reach us if you have any questions about what's happening with your health insurance coverage. And if anything just doesn't seem right to you, feel free to call us. You can do it by phone, you can do it by chat, and you can submit a complaint online. So thanks so much.
Great, thanks, Jane. Yeah, we'll put that up again. And a great job in explaining a lot of very dense healthcare material in a very cogent way. Okay, now we'll move on to talk with Sam Hatzenbeler from the Opportunity Institute, the Economic Opportunity Institute, and talk about healthcare advocacy. Sam?
All right, thanks, David. I'm just going to go into presenter mode here. So, as David said, my name is Sam Hatzenbeler, and I work on the health policy team at the Economic Opportunity Institute. And it's really great to be here with all of you from my living room. Today, I'm going to be talking about healthcare challenges and advocacy opportunities. So I know that many of us are already very well aware of this, that affordable coverage is already a challenge before the COVID-19 pandemic, but the current situation is really highlighting the dysfunction of our current health system and also underscores the critical need for health insurance for everyone. And for the first time since 2014, Washington's uninsurance rate went up in 2018. We know that premium subsidies and cost sharing reductions are important, but they're not enough to make sure that care is really affordable to everyone. So as this figure shows, sometimes when people are unsubsidized, they can pay up to a third of their income on monthly premiums alone. The purple bars represent people who receive subsidies on the exchange, and the orange bars represent people who are unsubsidized. This figure also shows that for people who are just above the 400% federal poverty level, they can spend a much higher percentage of their income as opposed to unsubsidized people. And so that really shows the income cliff there of people who don't receive subsidies. And also this does not include additional costs like deductibles and cost sharing. All right, so now let's take a look at the current situation since the pandemic began. And, you know, many people have lost coverage. I know that many people listening to this have either lost coverage themselves or they know someone who has lost their health insurance. So if that's you, it's important to know that you are not alone and it's not your fault. And there are resources for you. In that 5-week period, you can see on this graph, in early 2020, prior to the pandemic, our uninsurance rate in our state was 6.7%, but it really shot up just 5 weeks later to just above 10%. And of course, the good news is that there are resources for you to obtain insurance through Washington Health Plan Finder, either getting connected with Apple Health or buying on the exchange. So we know that we're gonna get that number back down just as soon as we can. Also, many people have applied for unemployment insurance. Just 700,000 people filed for unemployment in Washington in just a 5-week period. Before the pandemic, about 1 in 10 workers who were newly unemployed lacked health insurance, but now it's about 51% of newly unemployed people are uninsured. And so a lot of people are working hard to make sure that they can gain access to coverage, as Joan laid out for us. There have been some questions about how the federal assistance payments can change your eligibility for healthcare subsidies. So I wanted to include information about that. And for some reason there we go. So for folks that are receiving those federal stimulus checks of $1,200, that does not count as income for Apple Health, and it also does not count as income when buying a plan on the exchange. The pandemic unemployment, that's the additional $600 that people are receiving in addition to state unemployment. That's coming from the federal government. That also does not impact your Apple Health Medicaid eligibility. It does not count as income. However, it does count currently when you're buying on the exchange. I learned from Joan that they're working really hard at the exchange to make sure that this is going to be addressed. So at the moment, they're asking people to not enter that information. EOI is also partnering with other organizations to pressure our congressional delegation to change this so that people are not losing their subsidies. I wanted to speak to the unique struggles that undocumented people are facing right now. It's a struggle always for undocumented people to access health coverage, but it is particularly difficult during this pandemic. They were left out of the federal relief packages, even though many undocumented workers are essential workers and lack health insurance. It's appalling that that undocumented people are 11 times more likely to be uninsured than US-born citizens in Washington state. However, one good piece is that the Healthcare Authority has expanded what's called the Alien Emergency Medical Program. Normally that applies just to qualifying medical emergencies for green card holders and undocumented folks to cover things like treating cancer and organ transplant surgeries. But now it has been expanded to cover testing and treatment of COVID-19. There's been a lot of concern as well in immigrant communities about whether or not getting tested and treated for COVID-19 will count against you in the public charge test. And I wanted to let people know that it does not count against you. Also, ICE has announced that they are discouraging arrests at healthcare facilities. They aren't eliminating them entirely, but they are only making arrests in the most extraordinary of cases. So it's important people have that information. Advocates in Washington state are pressing for the Washington Worker Relief Fund. So the Economic Opportunity Institute, and in addition to 429 other organizations, signed a letter pressing Governor Inslee to create an emergency economic assistance fund for undocumented Washingtonians because they were left out of the federal relief package, and also to create a permanent wage replacement or unemployment insurance program for undocumented workers who have lost their jobs. So I just want to say that, you know, Washington state is such a leader in health equity, and we have some really amazing leaders in our state and amazing worker protections and laws that have been passed. And I'm sure I don't need to remind all of you that the reason we have all of those things is because people have really organized to make that happen and fought really hard for the protections that we do have. So we've made a lot of great progress, but we have also a lot more work to do to make sure that everyone has what they need, including affordable health care and health coverage for everybody. So I'll share a few things from last legislative session that we focused on in terms of health policy at EOI. A few things were working to expand healthcare to undocumented young adults through the Apple to age 26 bill that sadly did not pass. We also worked on expanding Apple Care to women and birthing parents up to 1 year postpartum. That did pass unanimously or nearly unanimously through the legislature. However, Governor Inslee vetoed it along with many other cuts he made due to the COVID-19 budget crisis. We also worked on a number of bills to tax the enormous reserves and profits of health insurance companies in order to help us fund subsidies and low-income health insurance programs, but those did not pass. And I think that really underscores the need in the need to address our state's regressive tax system in order to address our affordability, our healthcare affordability crisis. I don't think we will truly be able to address that without also changing our tax structure. Many people have heard this, I'm sure, but Washington state has the most regressive tax system in the country. No state taxes poor people as highly as we do, to 18% of low-income people's income, while people that are millionaires only pay about 3% of their income in taxes. And Washington really relies on regressive taxes like property tax and sales tax. So that is going to hobble us in terms of coming back from this economic recession that we're in. And we're now facing about a $5 billion budget shortfall. And Governor Inslee has already cut several $100 million from our budget, and we're expecting more to come as well, either in a special session or potentially in the 2021 legislative session. So we have a lot of work ahead of us to make sure that these cuts don't disproportionately impact communities of color, poor people, low-income people, women. These are the communities that will really face the worst impacts from budget cuts. And we know that just cutting the budget will only serve to deepen and prolong the economic recession. So EOI is advocating for progressive revenue sources. A few examples are looking to a capital gains tax, taxing companies that pay their executives very high salaries, also known as a CEO tax, and also a billionaire's tax, which is a 1% property tax on intangible property over $1 billion. There's a lot of wealth in our state, and we need to make sure that we can pay for all of the critical services that we rely on in our state. EOI doesn't do a lot of federal advocacy, but I just wanted to highlight a few pieces of work that's being done around the country now. One is to, even though President Trump has said that he will not open a federal special enrollment period for people to access health insurance like we have done here in Washington, we can still pressure our members of Congress to take that action. Also, the Emergency Healthcare Guarantee Act is a proposal that is put forward by our very own Congresswoman Pramila Jayapal. And this act would basically enable Medicare to pay all costs of treatment for uninsured people. And it would also cover all out-of-pocket costs for people with insurance. And this would last as long as the pandemic continues. Also, we're expecting the next federal stimulus package to come down soon. And so people are working hard to advocate for a number of things to make that package more inclusive. One of the pieces is expanding Medicaid to include undocumented people, protections for protecting people against medical debt and debt collection right now, especially with some high bills people have received for treating COVID. And also to guarantee no cost sharing for COVID-related tests, treatment, and vaccines. All right. Okay, and that's it. Thank you so much. You can email me. You can also sign up for action alerts and updates on our website.
Great, thanks, Sam. EOI's had a great record of health advocacy over the last 20 or more years, and I'm sure they're going to continue to provide that leadership in the months to come as we work through this. We had some technical issues with our first poll, but I think we're going to try it again. We have a second poll we want to put up. And the question is, do you anticipate that you, a family member or a friend, are going to need insurance through Medicaid or exchange during this pandemic? So I want you to do that while we are moving on to our questions, and we'll come back to that hopefully in a couple minutes. I have a question. Actually, you all have done such a terrific job of explaining this that I don't think we have any questions in our Q&A queue. But I wanted to ask the panelists their opinion about what's going to happen to this coverage as this drags on most likely to the end of this year and into next year. What do you think is going to happen to this coverage? Is the state going to have to revisit this? Should people be concerned about that at this point? Anyone want to take that?
This is Joan at the Exchange. I can certainly take a shot at it. I think one thing we're doing at the Exchange is tracking our enrollment numbers very carefully, and we've seen new people coming in. We've seen, over 10,000 completely new people come in. These are people who didn't have coverage with us in 2019 and are coming in for the first time in 2020 to seek coverage. And we expect that's people who are getting laid off or who were previously uninsured and maybe felt like they didn't need coverage. But at the same time, we're having new people come in. We are starting to see a slight increase in the number of people who are both newly qualifying for Apple Health, but also leaving. And we know that about 30% of the people we survey about why they leave the Exchange say it's because of affordability and say it's because of cost. They don't say that they found other coverage. They just said it didn't fit their budget. And we fully expect, we were lucky in Washington State that we had grace periods extended so that people have a little bit more time to make their payments. But we know when those payments come due, some people are going to have a hard time making them, especially if they are out of work. So we're watching pretty carefully to see if our numbers of people who drop increase with an eye toward having that inform some additional steps we could take to improve affordability both potentially with some of the new money that's coming to the state and or during the legislative session next year.
And I think in terms of the future, there is the benefit of the exchange is that it is an entity that was formed by the federal government, and it is the premium tax credits are funded exclusively by federal funds. And as Joan indicated, there are still real affordability challenges for folks, but at least we have that sort of foundation or safety net that's in place. And with respect to the Medicaid program is what we call an entitlement program. As long as somebody meets the eligibility criteria, then they are eligible, they need to be covered and to be given coverage. And again, the Affordable Care Act, the great benefit of that is that the federal government pays 90% of the cost for the folks who are what we call the newly eligible group, the single adults, the couples that don't have kids who came in by virtue of the Affordable Care Act. So that, I think, this COVID-19 crisis is just a robust illustration of how the Affordable Care Act is just a critical safety net.
Yeah, I would agree with both of what Joan and Jane have said. And I would add from an advocacy perspective that I think it's becoming more and more obvious that a healthcare system that is largely based on people having insurance through their employment is not workable. And so I think there may continue to be opportunities for advocacy around ensuring that people have coverage regardless of their job, regardless of their income. It'll require prioritizing that with our state funding and federal funding, of course, as well with Cascade Care, which is a law that passed in 2019, creates a public option on the exchange. And so that is a plan that is meant to be more affordable for people and also more transparent to consumers. And they're working right now, the exchange and Healthcare Authority and Office of the Insurance Commissioner are working on a study to look at implementing subsidies up to 500% of the federal poverty level to make coverage more affordable. So I think as people continue to be unemployed, that public option is really going to be a really important option for people.
Yeah. So of the almost 250,000 newly uninsured in one of Sam's slides in our state, what percentage of those people are likely eligible for subsidized care? I mean, given that COBRA is so expensive.
How many are eligible for, care through the exchange, David? Is that what you said?
Yes, for likely eligible for subsidized care.
Yep.
You know, are not just left to the tender mercies of the private insurance market.
Thank you for the question. This is actually an area where we work pretty closely with OFM and the governor's office on tracking among the uninsured how many would be eligible for subsidy coverage through the exchange. And it's a fair number. Before the pandemic, there were around 400 to 500,000 people who were uninsured in Washington. And the estimate was that, you know, a few 100,000 of them were eligible for Apple Health and a few 100,000 of them were eligible for subsidized coverage through the exchange. So we know that there's a substantial number of people out there who are uninsured right now who could come in and find an option on the exchange that they could use to get care. We know that there's some continued affordability barriers, but really want to encourage people who are currently uninsured or think they may become uninsured to connect with their local navigator or broker or travel assister and ask the questions they need to make sure they're evaluating their options.
Okay, so in our poll results said that 80% of the folks who are listening right now said that they or someone they know is likely to end up going to the exchange for health insurance during this period. So that's just one more indication of that. All right, I think we're going to wrap this up. Any of the panelists want to make one last short comment, sort of a top line message?
we go in reverse order? Sam, let you go first since you had to sit through our presentations first.
Oh, I learned a lot from both of your presentations. I would say my main message to take away is just that people have all the power, and we can advocate for a system that works for everyone, where no one has to go without health insurance because of their income or because of their citizenship status, and just to stay connected and look for advocacy opportunities.
Great.
And I guess what I would say is, yep, our healthcare system is a piecemeal system, and there are a whole bunch of different programs, and it can seem really complicated, but there are staff at the Health Benefit Exchange, there are staff at the Office of the Insurance Commissioner, there are navigators whose job is to help folks connect to care and connect to coverage. And please don't feel, nobody should feel that they have to figure this out all on their own. We are here to provide support, and Joan and me and a whole bunch of other people, our purpose in life is to try to make sure people access the healthcare that they need.
Yeah, I'll echo what Jane said. I think we're all hands on deck trying to make sure people get connected to the coverage and the care that they need. And that includes both finding insurance and also being able to use their coverage for things that they need, whether it's COVID related or care that they maybe have been putting off because they were too worried to go to the doctor to get it. So I think there are resources in the state that are dedicated to helping you, and we look forward to serving people who are interested in coming to the exchange and seeing what we have to offer. I'll also wanted to highlight that, you know, there's a lot of national noise around healthcare. There's a lot of politics around healthcare. There are a lot of things that are happening at the federal level. There's a federal marketplace that serves 32 states, and Washington has its own exchange. So when you hear messages coming from DC or coming from national publications that say, you know, they're not opening a special enrollment period, and you know, we're limited in what we can do in terms of outreach and education, they're not talking about Washington State. That's not us. We have our own state-based marketplace. We have our own special enrollment periods, and we have our own sort of agencies and governor's offices and commissioners who are committed to connecting people here to coverage. So really important to check with your own local resources and try to tune out some of the national noise around this that could be really misleading.
Great. So people who might be frightened of some of these costs, they really do have options. And it's, from what I understand, getting through to the exchange's staff is a little easier these days than getting through to the unemployment lines, for instance, or to Employment Security Department. Is that right? You don't have long waits to get in touch?
We don't. We saw quite a big surge after open enrollment. So there have been times when people called and experienced a little bit of wait. Those wait times are down now. A lot of the work you can do online through your phone, through our platform, if you just want to hunt around and look for coverage. If you want help, particularly if you want help in another language, that free help is available to you either through our call center or through our sort of extensive ground network of navigators, brokers, enrollment centers, et cetera. So definitely help is waiting for you. And again, our navigators often set up enrollment events and go to employers and talk to staff and talk to people about their coverage options, and would be happy to do that if people are interested.
Terrific. All right, I'm gonna wrap it up. We're just about out of time. I want to thank our panelists for coming on, and the other Labor Center staff that worked on this webinar. For those of you who might be union stewards, please take this information to your coworkers and your neighbors. Sign up for our special trainings or work with your union local, and connect with the organizations like EOI represented here to continue to learn more and work on advocacy if that's something that's important to you. The rest of this series, with the next 2 Thursdays, we've had a lot of people want us to revisit the unemployment question and how to get signed up for unemployment, and also worker retraining issues. We will send out invites. We'll follow up with the links, resources mentioned here, and the recording will be posted on YouTube and linked on our Rights at Work Washington website. Thanks for all of you attending. Good night and stay safe. Thank you.